this will be a little bit different because there's more tests to do during a cranial nerve exam. So yeah. Okay, so I'm just gonna go ahead and put it up on my computer here. Put it up. Okay. So yes, we'll go down the list. Doing all the Propless techniques that I've learned here at Josh's clinic. Josh has taught me a lot of these techniques. He's a great guy, you know. Okay. So let's start with the olfactory nerve. If you're okay, you consent. Okay, wonderful. So what this basically is I give you something to smell, and if you smell what it is, then your nostrils are good to go. Okay, so I'm just going to let you smell my hands, okay? Because I've, done a little bit of shaving and stuff, so I've put some stuff on. I won't tell you what it is, obviously. Okay, so can you just smell my hand for me? Okay. What was that? Sandalwood, thank you. That's exactly what it is. So, yeah, you passed that test with flying colours. Okay. Let's move on to the optic nerve. Now, what we do for this is basically testing your vision. Now, there's a couple other times during this test we also test your vision. But, yes. What we basically do is let me read this out to you, actually. Visual fields are assessed by asking the patient to cover one eye, while the examiner tests the opposite eye. The examiner wiggles the finger. You've done this before. Yeah, you've done this before in the Propless eye exam test. Okay. So what I'm going to ask you to do is go ahead and cover one of your eyes. I'll wiggle my finger, and I know what I'm looking out for. Okay. Okay. Go ahead. Okay. You can cover that one. Okay. Do you actually have anywhere to be? You don't? Well, we do it fast anywhere in the Propless department. That's just how we were trained. Okay. Okay. And can you do the other eye for me? Just cover it up. Okay. Okay, so now I'm going to write this down. Yeah, I'm just writing it down. Usually I just keep it in my brain, so this usually helps me out because I look at what I'm writing on my hand imaginarily, and it keeps it in my brain, it keeps it in my brain. Okay, let's move on now to the oculomotor nerve, the trochlear nerve, and the abducens nerve. Now, these are sort of, I would say, one of the two key nerve examinations in this test. So, just give me a second, okay? Read that magazine whilst I'm learning what to do on the spot. Okay. Okay, so what I'm going to do is I'm going to measure about a meter. Say, that's about a meter between us. Do you not agree? Okay. So, I'm going to just draw an imaginary H, okay? And I want you to report if you see any problems with that. Okay, so I'm just going to do it, okay? See any problems with that? No, everything was fine. Okay, drawing it imaginary down. Okay. Okay, so I'm just going to go ahead now and take a look at your pupils more directly than before with the other tests we did for the optic nerve exams. So just go ahead and open your eyes as wide as possible. I'm just going to take a look at them. Okay. Yeah, let's see around about that size. That's roughly about the size you want. You can tell by the size of mine. Mine are actually perfect 20/20 vision. Okay. Yeah, that's not what we were testing for, but anyway. Okay. Next, I just want to do the light test, okay? Now, I've got my imaginary light here, so I'll go ahead and turn it on. And, yeah. Okay, wonderful. So, I just want to take a closer look, see if there's any issues. Now, you said before there wasn't any issues in your Propless eye exam, so I don't think there will be any issues here, but it's always good to take a look anyway. Okay. Okay. You're looking fresh, actually. Okay, and now the other eye, so just open that one as wide as possible. Okay. Okay, you look good to me. Okay. I just want to test, if I get close to your eyes, okay? Now, this is sort of in the trigeminal nerve exam, but, yeah. Sort of get close to your eyes. I want to see the reaction of your eyes and your eyelashes, see if, you know, you're all up to date. How old are you? Okay. So, yeah, so you should have a roughly about 2-second reaction time. Okay. So, let's just test it out, shall we? I just want to keep your eyes open as far as possible for me. Okay. Okay, that was about 2.5. A little bit slow, but not too bad. And how about the other one? Okay, yeah, not too bad. Not too shabby. Okay. Now, we're going to move on to the facial nerve. Now, this one, you know, it's probably the most unnecessary one in the whole of this exam, but it has to be done. So, we're just going to expect some facial motives in the facial area, obviously. So I'm going to ask you to raise both of your eyebrows for me. Yeah, like that. Okay. Did you have any trouble with doing that? No. Okay. So can you now frown for me? Yeah, I understand you're a happy person, but okay. Okay, wonderful. Close both eyes tightly so you can't open them, and we're just going to test the muscular strength. I'm going to try and open them, but you're going to try and keep them shut, okay? Okay, do it. Yep, like this. Okay. Oh my god, you have some strong eyes. Okay, wonderful. Show both your upper and lower teeth. Okay, so you've been keeping them nice and white. Have you done a dentist test recently? It's been about a month. Okay, well, you might want to go to the dentist again. It seems you might need a filling. Okay, so, yeah. Definitely go check out. I know Josh has a little dentist down the road. Yeah, so check that out. Okay. Now I just want you to smile and then puff out your cheeks, okay? Smile for me, smile. Okay. And then puff them out. Okay. Everything looks fine there for the facial nerve. Yeah, as I said, that's probably the most unimportant test, but it has to be done. It's on my little sheet here we have to do. So that's just how it is. You know, I listen to Josh, you know, a lot of the time he says a load of rubbish, but don't tell him that, okay? Now we're just going to test your hearing. I'm going to whisper about 5 numbers into one ear, whisper 5 different numbers into the other, and I want you to repeat them back to me after I say each one. Okay. Okay, so I'm going to go ahead and repeat 5 random numbers, okay? 1, 4, 7, 7, 10. Okay, can you repeat those back for me? 1, 4, 7, 7, 10. Yep. Okay, so I'm going to 5 completely different numbers to that, and yeah. 6, 4, 12, 24, 10. Okay. You only had the first one. Okay, well, let me write this down. I need to write this down. Write it down. Yeah, do you always have a problem with the right hearing? No. Okay, well, we might need to check that out. You can definitely go see our ear exam doctor. He's just down the other department there. Okay, so you might want to go see him, you know, next week or something. Okay. Okay, the next one, I hate doing this with my patients. You know, my patients usually laugh at me for doing this, but it's the vagus nerve, and guess what? We have to test your gag response. Now, every time I do this, people laugh at me, but it has to be done, because if I don't do it on my sheet, Josh would come in and he'll smack me one. Okay, so just open your mouth as wide as possible. I'll put my fingers in as far as it goes, and we'll see how you gag. Okay, wonderful. Wonderful. Okay, you ready? Okay, that's decent. That's normally, you know, right amount. Yeah, usually, men have, a quicker gag response than a woman, just from my, my tests and, my experience. I don't know exactly why that is, but, yeah. Okay, so let's move on from that. Let's go on to the second to last nerve, and then we can get you out of here. Okay, well, after I write some stuff down. Okay, so I want you to shrug your shoulders and then turn your head from side to side. This is the accessory nerve. Okay, very unimportant really, but I guess it's on the sheet, so we gotta do it. shrug your shoulders for me like this. Okay. And then I want you to turn your head from side to side. Feel quick. Yeah, I know my hair is terrible. Okay. Okay, that's great. Okay, so the final one, hypoglossal. Stick out your tongue and move it to one side like that. And then I'm just going to inspect your tongue for any issues. Okay. Okay. Okay, do you mind if I touch your tongue, you know, with my hand? I've washed my hands, so it's all fine. Okay. Okay. Yeah, it looks okay to me. Yeah. So I'm just gonna write what I think down. Write the problems down. I think there's only about one problem, really. Maybe two. And yeah. Okay. So let me just get this down. Yeah, you can read that imaginary magazine whilst I'm writing down this imaginary piece of paper. Okay. Okay. Okay, so what I'm going to tell you is you want to see an eye exam doctor within the next week, or as soon as possible, basically. Because when I whispered into your left ear, wasn't it? Yeah, because it's mirrored. When I whispered into it, like 410, whatever I said, you only got the first number. Okay, so maybe you weren't fully listening. We could do it again if you want. Do you want to? Okay. 2, 3, 4, 5, 6. You only got 2 and 3. Okay, well, yeah, I think that really shows. Maybe there's a little bit of wax clogging it, but maybe there's a bigger issue you need to take a look at. Okay, so yeah, well, that's sort of the only main problem. Your pupil size. Let's just say size. A little bit smaller than a usual pupil, but do you take any drugs? No. Okay, so maybe it's just, you know, you woke up a little too early or something like that. I think you'll be fine. Okay. So yeah, that's about it. I appreciate you coming into Josh's Nerve Exam Clinic, or the Propless department as we like to call it these days. Okay. Okay, well, thank you. Okay, yeah. I will go down to the department and ask for an eye exam for you. What's the name again? Okay, and the phone number? Okay, so I'll give them your phone number and they'll get in touch. Okay, wonderful. Well, I really appreciate you coming in. This Propless exam wasn't as bad as other exams I've done during the eye exam and the haircut exams. Okay, I do haircuts at Josh's Barbers. Yeah. Well, yeah,